I am Raminayan Ankamarao, coming from Hyderabad. In last 4 months, I have hospitalized the third time because of the fluid build up in chest, and they told pneumonia and problems. I joined first in July, and then August also repeated the same problem. They identified the valves leakage some 10% only. So I came to India in 1st October. Then after 20 days, same problem repeated. So I approached Apollo Hospital's Dr. Rahul, cardiology. They first removed the fluid, and then they identified multi-valve leakage in the heart, and then they taken some T3 test. After that, they clearly identified valve leakage problems. Because of this, fluid continuously frequently building up and hospitalization is happening. Now they have identified the problem, and MitraClip procedure they have adopted day before yesterday. Now I am somewhat definitely better. Breathing, fluid build up, it will take some time. So they will give precautions, and based on that, without any pain, within 2 days they are going to release. Apollo Hospital, they have facilities fully, they have got full facilities. Thank you Apollo Hospitals, particularly Dr. Rahul Chowdary and Manoj Agarwal sir. They have helped a lot, and they fixed without any problem and without any pain. Now I am comfortably breathing everything. So thanks for the Apollo Hospitals. They are providing them excellent facilities.
Hello everyone, I am Dr. Rahul Chowdary Kongara, trained intervention cardiologist and structural heart specialist. Today here we have with us Mr. Raminayan Ankamarao garu. So Mr. Ankamarao garu came to us with complaints of breathing difficulty for a really long time, and he has been suffering with this problem for quite some time. So he had hospitalizations in the last 1 year for almost 2 to 3 times, and he was not able to do his day-to-day activities and was not able to get good sleep, and he was constantly suffering. So when he came to me in the OPD, I had a suspicion of heart failure, and I checked him thoroughly. So after checking him thoroughly, I was able to diagnose that he was having severe mitral regurgitation. So during our echocardiographic examination, I made sure that the diagnosis was correct, and we were able to find out that he had severe mitral regurgitation. So the next option was to give him some symptomatic treatment. We tried giving him some drugs, but he was not tolerating the drugs properly. Then one night he called me saying that he was feeling severely breathless. Then I asked him to come down to the hospital, and he came to our hospital, and we admitted him to the ICU. On coming to the hospital, we found out that he had severe pulmonary edema, and he was having low BP and other things. So we immediately took him to the ICU, and we stabilized him with diuretics and other drugs. So next we had a heart team discussion about how to proceed forward. So given his condition, his age, his previous surgical status, as you know, as he's having bypass surgery previously, so we were in a dilemma what to do next. We had a detailed discussion with the surgeons. So the surgeon said that he was not a right candidate for a redo operation. And then we thought about this new therapy called mitral edge-to-edge repair with MitraClip. So since we are trying to do this intervention, and we have a good team here at Apollo, we were able to do this MitraClip successfully on him, and we were able to cut down his MR to a significant level. And as you can see now, it is his post day 2 of the procedure, and he's fine, and he's able to walk, and he's able to do his day-to-day activities quite normally. Hopefully, during the follow-up, his symptoms should improve much better. So, thank you, sir.
Thank you.